This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, we're live in the midst of all our newfound normals, so to speak. God, I hate that name, but nevertheless, we're here for you and bringing you the important information that you need to know to take care of your health, that of your families, and making sure that you ask the very right questions to keep you all very well protected. So we're here at 888-630-9625. That's 888-630-9625. You know, you want to make sure that you know how to ask the right questions and you really understand the ramifications of so much that was out there. And I've been listening to all of the hype and the misinformation and the twisting of things over a period of weeks and weeks and weeks. And, you know, the doctors and the staff of the Roselle Center for Healing were there, and, you know, we're superseding CDC regulations to make sure that you're comfortable, you know, when you come to the practice, and, you know, that we take care of you as quickly, effectively, and as efficiently as we can, and, you know, get you in and out of the office. But there's a lot of things that we'll touch upon today and things that you need to know about. But we're going to talk about actually the number one killer in the United States. And we're not talking about COVID-19. And we're not talking about the flu epidemic of 2017 and 2018, which killed 80,000 people. So what are we talking about? What are we talking about that is more significant, that kills more people in this country than anything else that you can think of? Got it? Well, what it is really is your heart. It's cardiovascular disease. That's the number one killer, still is. It takes out more people than any pandemic that we're dealing with right now. And I want to walk you through that a little bit because there's a lot of similar characteristics that, you know, we're being told about with this COVID and other flus and colds and, you know, chests, whatever. But how do you distinguish these things, and how do you really understand the intimacies of all of this and think through the process? Unfortunately, the United States of America has one of the lowest health wellness indexes in the world for industrialized nations. We spend more money on healthcare. We waste more money on healthcare than virtually anybody else on the planet. We spend twice as much money on health and wellness than the next competitor on the marketplace. And so, but you would think that we'd be number one. You think that, you know, at least we'd be number 1, 2, or 3. Well, not so much. We're number 35. Number 35 on the hit parade, my friends. And so what are we doing wrong? Why are we in such dire, you know, desperate need of changing something? And we react and we think that, you know, that this COVID-19 is the end all and be all when it comes to devastation and taking us out. Well, what I want to tell you is that muscle, if you will, about the size of your fist that sits in your chest and causes blood to move and oxygen exchange and so forth, and is affected by many things, is the primary source of your health and wellness. And we want to talk about that, what it really is all about. And, you know, so as I was reading and, you know, looking at risk levels and so forth, and, you know, being the number one cause, you know, it's while family history of cardiovascular disease can increase your risk of potential heart attacks. And by the way, we can shove this over to mean strokes as well, by the way, but then we just exponentially took everybody else out of the neighborhood when it comes to, you causes of death and the like. But you look at your health history. When people come into the office, we're very careful to evaluate what's really going on. Somebody has chest pain. Well, is chest pain a heart problem, or is chest pain the result of your inability to get full expansion of your lungs in the lower portion of your lung cage due to not COVID-19, but your diaphragm, this big muscle that cuts you in half, that is supposed to assist, if you will, the heart in moving blood throughout your cardiovascular system. Okay, all the miles of arteries and capillaries and arterioles and veins and venules and so forth. And, this is the guy, but it's helped by many other things. That diaphragm is one of the prime movers. So understanding the many phases of cardiovascular disease is critical to really understanding how do you keep yourself well. And so what we're doing right now is we're adding to the risk level. What do I mean by that? We're adding to the risk level because we're at home, we're worried, we're stressed out, we're drinking more than we normally would drink, we're eating things that we would normally not eat, or maybe not quite as much, or, unfortunately, this country, you eat a lot of sugar. And, because they're comfort foods, right? We go out and we go to the grocery store and we're scared to death that, God forbid, somebody should talk to us or stop us because, oh my God, we're going to end up with, COVID-19 and we're going to die. Well, the truth of it is that, it's serious, as I've said many times before, but in my opinion, it's something that can be dealt with just as effectively if you understand the ramifications. But let's talk about this, this heart problem, these cardiovascular conditions. And if you have a question on the medication you're taking, if you have a question on how this ultimately moves forward, call me at 888-630-9625. That's 888-630-9625. So understanding the many facets or faces, if you will, we can use that, the many faces of Eve. You remember that book? We won't get into that right now, but the many faces of cardiovascular disease is really significant. How is someone supposed to know? So the latest recommendations for things like cholesterol, can seem to be a moving target. And, when I was in school back in the day, normal cholesterol was about 230. And now, they want you under 200. Why is that? See, cholesterol is not just cholesterol. Your body needs cholesterol. You need it for brain function. You need it for hormonal function. You need it virtually for all kinds of processes in the body. So studies over the last 20 years plus have identified that chronic inflammatory reactions, chronic inflammation is the most important risk factor when it comes to cardiovascular disease. Inflammatory reactions. So let's compare that just for a half a second to COVID-19, right? What's the problem with patients with COVID? What's the initiator? It's this cytokine storm, and that's a big word for inflammation. That's all it means. It means that there's this huge inflammatory reaction that's taking place in the plumbing of your body, but very specifically into the respiratory system, and then you get this mucus secretion that comes in afterwards. And just very much like allergy reactions this time of year, by the way. So a lot of you are coughing and hacking and sneezing and carrying on, and you wonder, oh my God, I must have COVID-19. No, you've got allergy reactions due to springtime stuff. So, the understanding this low level constant inflammatory reaction that is there all the time, that is leading to a condition called atherosclerosis. And that means hardening and damaging of the arterial system. The damage occurs over many years, and plaque, that fatty deposition begins to accumulate, and chronic inflammation weakens, the existing plaque, and so making it more vulnerable, if you will, to bursting and causing dangerous blockages within the system. So here's the situation: that plaquing that occurs, that fat that goes in there, is a result of your body doing something that it should do naturally, and that's protect you. It's trying to put the fire out. It's trying to put the inflammatory reaction out. So you could draw that to the COVID-19 as well. The cytokine cascade now has its sequela called mucus that gets into the air sacs. By the way, they're called alveoli, and now they plug it up. Just like in your heart, you're getting plugged up by fat that's actually trying to make a difference and try to help you. But, you become much more vulnerable, if you will, and you need to understand that these inflammatory pathways are a result, if you will, to a lot of different things. And they can be a very strong predictor, if you know how to measure them, of a first-time heart attack. And one is C-reactive protein, or coronary C-reactive protein, which measures the inflammatory reaction within the vessels of the heart. So, one of the best ways, to reduce inflammation, and you've heard me talk about it for a long time, is one, clean up your diet and get the sugars out of there and go for a walk. Just get out and walk. Over the years, if you've been a listener to Dr. Tom Roselle Live, you've heard me say that if you go out and walk 2 miles every day, you decrease your risk of dying of a disease process by 50%. That's huge. That's every day, 2 miles. I'm not telling you how fast. You can do it lumbering along and just relaxing and doing those things. But 2 miles every day decreases your risk of any kind of disease process, including cardiovascular disease, by 50%. So one of the best ways, in addition to that, is taking certain nutrient bases. And you all heard the omega fatty acids, omega-3s and 6 and 9s, and DHEA. So the EPAs and the DHEAs, they're constantly under review and research and so forth. A lot of it is coming out of Sweden, my favorite country in the world, because they didn't shut down, but that's my opinion. Now, I know that flies in the face of a lot of other people, but they're in a heck of a better place than all of us. And everybody says, well, yes, and there's going to be, everybody's exposed. Well, that's herd immunity. That's what you want to have. And, what most of you don't understand is that you probably have antibodies to about 150 different types of viral patterns in your body right now as we're sitting here talking and discussing all of this. But, omega fatty acids put the fire out. They decrease the clotting factor within the body. So it saves you from, other medical interventions. And I'm not saying they're not necessary, because there are many cases where you're in an acute situation. Let me tell you, I'm going down that venue. What the best strength that this country has relative to medical arena, my opinion, is immediate medical intervention. You have a heart attack. You're going to die. You have something going on. They step in and we do it better than anybody else. But when it comes to chronic long-term care, we got a lot to learn from other places around the world, but unfortunately a lot of their stuff is being dampened. So coronary artery calcification and heart disease have a lot to do with, the alteration of blood flow. It has to do with inflammatory reactions. It has to do with narrowing, something called stenosis. Many of you have had back pain and neck pain and shoulder pain. You've gone to the doctor, you've taken an MRI, and it's come back with, you've got spinal stenosis. Well, stenosis, all that means is a narrowing. And as a result, you have a problem. Well, the same thing can happen in the heart. And we're going to talk about oxidative stress. We're going to talk about your blood pressure a little bit. We're going to give you some things that you can do to make a difference. It's important that you understand it. And as we get through, the program today, I want you to have a better understanding on how you can help yourself. And so why did I pick on cardiovascular disease today? Because so many of you are home freaking out over this coronavirus, this COVID-19, and you're increasing your cardiovascular risk. You're making life worse for yourself. And you need to calm down and realize that you have control. My book, Health is a Do-It-Yourself program? You have up your immunological system. You have control of the ability to be able to change virtually anything that you have going on if you have the right information. And that's what we do here at Dr. Tom Roselle, is that we give you the correct information so you can apply it better than otherwise, right? So we're coming up to a break. I want you to stay tuned because I have a lot of information for you. Don't go away. You're listening to Dr. Tom Roselle Live. I'll be right back. Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am, that is, live, and we're talking about some very interesting thing. I started out the program by saying, everybody's so afraid of COVID-19 and we're all kind of buried and sheltered. But you know what? That's not the number one thing that kills us. The number one thing that kills us in this country, in the good old US of A, is cardiovascular disease, and it still is, even in the light of all this. But we're not quarantining people. We're not keeping them away from, oh my gosh, you can't touch this. But at the end of the day, this is a risk factor also for COVID-19, because if you have cardiopulmonary conditions, that means heart, lung conditions, and you're on medications, your risk level for COVID-19 and any pneumonia is going to be increased over the general population. And you have to, make sure that you take care and heed. And, there's lots of things that you can do to protect yourself. And, you heard over the weeks, we've talked about straight, simple things like high levels of vitamin D and zinc and a good probiotic and lots of vitamin C on a daily basis. And if you start feeling any respiratory function, there are things out there that can make a difference. They can support your immune system. And, things like NAC, which is N-acetylcysteine, and then quercetin, and, increasing those levels with zinc and so forth, and colloidal silvers and the like. Ozone therapy, which is oxygen that is shunted in the system. All those things can make a difference. But anyway, now, having said that, love to take your calls on cardiovascular disease or any questions that you have about what's going on in our world today at 888-630-9625. That's 888-630-9625. Let's talk and let's see what we can do to make a difference. Before I go on the program, I just want to take a moment, and I have to acknowledge somebody who is very near and dear to, my life and my family's life, and just to reach out and shout out, and it happens to be her birthday today. And just simply say, Betty, happy birthday. God bless you. I hope everything is going well for you, and we'll see each other again. But have a great day and enjoy it, and know that we're thinking about you. Cardiovascular disease can be measured relative to risk factors. Coronary artery calcification, that's hardening of the arteries. That's when everything is plugged up. When I was in school and we did cadaver studies, we'd look at them, and a lot of them were much older folks that had donated their bodies to young doctors who needed to learn anatomy. And we saw this hardening, this thickening, actual hard calcification that got into the arterial beds and impeded the flow of blood supply and oxygenation and things that we needed. And we've learned over a period of time that, smoking and things of that nature dramatically increase the risk because they hurt, they injure the body. But physical inactivity, as we said about earlier, and chronic stress, which is going crazy right now. Everybody's just so worried, and that stress pattern goes up, causing inflammatory reactions, inflammation, overweight or being actually obese, it increases your risk of blood supply and so forth. A diet that is very high in sugars and processed foods. Those are the things that increase your thing. And over alcohol indulgence. A glass of red wine is, I'm not going to say that it's healthful for you, but it's definitely not in moderation, meaning a glass 2-3 times a week is actually health productive, according to a lot of studies that have come out of Europe and France and so forth, relative to cardiovascular circulation. I'm not telling you to go drink wine, because the active ingredient in that protects you is something called resveratrol. And you can get that in supplementation form as well, but you can't get it for whatever reason, you can't get it from grapefruit juice at the levels that you need it, but nevertheless, so when we're talking about, this problem and increasing blood pressure risk and so forth, it affects every social class. There's, nobody can hide from this thing if you're doing all the things that, will cause the risk levels. If you're a smoker, if you're stressing, if you're eating the wrong things, and, all the way through. So you've got to make some changes, right? So the risk levels they shift. Guys, men over the age of 43 and women over the age of 55 face a higher risk. And why women at age 55? Well, that's when they finally go into, most women on average start moving into menopause. Their estrogen levels drop. And estrogen, by the way, is tissue protective to the cardiovascular system. So when that starts going away, you start seeing more risk in cardiovascular conditions in women. Men are more susceptible, apparently, to hypertension than women, but in our experience over the years, women just as easily as men can get the problem. So African Americans are more likely to experience high blood pressure and cardiovascular diseases as well. And why is that? I had a conversation with a patient the other day in the office, and African American man, guy that I've known for many, many years. And he asked me, he says, why are people, and he said, black people, African American people, more at risk than other people when it comes to this COVID-19? And I said, probably the same reason that you have a higher risk of heart disease and blood pressure problems. And he just looked at me and I said, you see this beautiful black skin that you have? And I said, that's there for a reason. It's because the origin of that is usually where the sun is very hard, very direct. And so subsequently what happens is that you need protection. You got to protect yourself so you don't stimulate as much vitamin D as other people do, because you need the sun rays to stimulate vitamin D. And if you can't do that, then your oxidative stress to the system generally across the board goes up and your immune system weakens. Vitamin D is critical to support immunological function because it hits every platform that you have in your body. It protects you. People who have certain type of cancers have a risk level that is, increased because of that. So we have to make sure that we understand why things show up. And in that particular case, so, somebody that is from Latin America, somebody is from, areas where the sun is very direct, they're going to have darker skin. I'm going to put them on high levels of vitamin D for cardiovascular protection than I would anybody else. We're coming up to a break, and I want to get into this a little bit more in the second half of the program. I'm going to talk a little bit more about, the different things that you can take and so forth. But we'll be right back. You're listening to Dr. Tom Roselle Live.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, we are live and trying to bring you the most important information. Doing a program on cardiovascular problems, heart disease and hardening the arteries and so forth. And started out the program telling you it's the number one cause of death in the United States, period. End of story. Nobody surpasses it, even COVID-19. So what are you supposed to do with all that information? Well, that's what we're trying to do and give you some protective measures. And, we went through a little bit of your risk levels. And, unfortunately, guys, you start out at a higher risk than women do. And there are different, many different cultures that have higher risk levels and so forth. But we're going to get into that. But right now, there's a lot of people that are waiting patiently. John, how can I help you, sir?
I think amlodipine is a blood pressure medicine. I heard you discouraging the use of it. I've been on it for a couple of years. I needed some feedback.
No, it's not that I was discouraging it. What I'm saying to you is that you have to understand the underlying reasons that blood pressure begins to spike to begin with. The side effects of amlodipine are, things like dizziness and, lightheadedness and swelling of your ankles and flushing, may occur anywhere. And a lot of these things are side effects that are causing damage that over a period of time can be just as egregious as the drug itself. And if you have something like that, you really need to, talk to your doctor. But what you also get is this lightheaded feeling when you get up, slowly when you're rising from a sitting or lying position. The reason for that, it has an effect on your fight-flight system, on your adrenal system. And that's an organ system that can cause blood pressure problems, but it can make things much worse as well. There's a hormone called angiotensin, angio meaning blood vessel tension, tones, and it's supposed to put a little tone into the arterial bed. And when it's working normally, you can change posture patterns without any problem. But amlodipine and other things can not only drop your blood pressure, but drops it too low. And that feedback mechanism, if you will, with the system is problematic. So, it's very important that any physician that puts you on blood pressure medication watches the effect and tweaks it. In every situation, less is much better. But you want to find out what the cause is. You want to find out what's triggering this. We know that the nervous system, your brain, spinal cord, 31 pairs of nerves that come off your spine, they go to all the organ systems. And if the nerves aren't firing properly, then you can have high blood pressure, you can have low blood pressure, you can have, predispositions to all types of things. Unfortunately, that, in the medical model, if you will, the medical arena, they look at things in a compartmentalized situation. We got blood pressure, let's get the blood pressure down, instead of asking the question, why is that? Where's it coming from? And what can you do about it? But you get a drug like, amlodipine, and it decreases your ability to adapt, and it also can dehydrate you. It can make you lose a lot of water because of its effect on the kidney, on there's a renin pathway that allows for fluid to be maintained in an equilibrium, if you will. So I hope that helps you. You need to take your blood pressure at the same time every day, and not just, at nighttime. Then next day you're going to take it in the morning, or you're going to take it midday, and so forth. But you want to see the upper pressure, the systolic pressure depends on age. I'm not the guy that's going to say everybody's got to be on 120. The lower pressure, the diastolic pressure, is the relaxation phase, if you will, in the arteries. And a lot of times, many times, both of those pressures can go up just because there's not enough adequate mineralization or hydration within the body, causing more disturbance and shunting. And there's a lot of other reasons for it. There's calcium channel blockers, and that's saying there's too much calcium, so the muscles go into tetany. That means they go into a spasm, if you will. Your arteries will do the same thing. So hopefully that helps you. And, if I can be of further help, just go to rosellecare.com, send us a note, and we'll get back to you and very specific. Obviously, I don't know a lot about your health, John, and, it's unfair to give you a complete stop this without knowing more about you. So I hope that's useful. Let's take another call. Peter, calling from Silver Spring. How can I help you, sir?
Yes, good morning, doctor. I was like your opinion on CBD oil.
As it relates to what? Pain, inflammation, anxiety, or just a general?
Everything that they advertise it for, really.
Okay, so let's start out with CBD oil is non-addictive. When you talk about marijuana, you're talking about the psychogenic effect, which is THC, and that's a hallucinogenic effect. CBD that is produced within the plant itself also has tremendous health-giving properties. Every cell in your body, every receptor has an attraction, if you will, for the CBD itself. So we use it in the office. We use it. But the one thing that I will tell you is you want to make sure that if you're going to use it for anxiety, if you're going to use it for anti-inflammatory effects, which it has a really profound effect on the body, if you're going to use it to decrease pain, that one, you want an organic form always. It has to be organic because you don't know how it was raised, and you want a reputable manufacturer that you're getting what they say that you're getting. And so, there's a lot of sports creams that are out there now, and some of them are really good and some of them are not so hot. There are some things that, I wouldn't put on my body, but there's a list. We could go through and probably list several dozen manufacturers, and some of them are quite spurious. But some of them are very decent. Again, we use it in the practice with patients based on what their need is. There's other things that will do a better job. So you have to, can you get hurt with CBD oil? That's probably a better question at this point. As long as it's organic and as long as you're following directions, probably not. The creams are pretty excellent. They help a lot. But you know what? Here's my opinion on stuff like this. Anything that you do that you have to do on an ongoing basis to fight a symptom tells you that there is an underlying problem that needs to be explored. And you have to answer the question, why is that? Why is it taking place to begin with? What is the problem that keeps triggering this thing that you have to keep using something like this? Patients come in and, I put them on magnesium, for example, and there are many different forms of magnesium, from magnesium glycinate, magnesium citrate, magnesium aspartate, and so forth. It goes on, actually. And they have different attractabilities within the body. And they say, well, why do I have to take this? Well, You don't if you make sure that you eat a ton of very supportive, nutritive foods that contain this. But I'm talking about making sure you're not skipping meals, you're getting a lot of calories in your diet and so forth. The majority of people in the North America are magnesium deficient. The majority of people in this latitude are vitamin D deficient because the sun rays after September until about this time of the year aren't direct enough that even if you were outside in the sun with little or no clothing on, you're not going to get any vitamin D stimulation. The melanocytes are the cells within the tissue that causes that to take place. So when you're dealing with something like CBD oil, it's good stuff. It works. It helps. There's a place for it. But if you find that you have to use it all the time, that tells you that there's other systems that have not been looked at properly. There's an inflammatory reaction. So can you get in trouble with it? Not really if it's organic and it's coming from a decent manufacturer. But again, you have to ask the why is it. I hope that helps. And if I can be useful to you, go to rosellecare.com. You can, give me a little bit more information. If we can help you at the center, just pick up the phone and call, and we're happy to evaluate and see if we can find out what the underlying problem is as well. There's so much to cover when it comes to crossover considerations of a lot of different things, whether it's something like CBD oil and its effect on inflammation, inflammatory reactors in the body. When you're talking about COVID-19 and you ask the question, why do we have that cytokine cascade? Why does it cause the problem? And then why does the mucus come? And then why do we plug up the system? My patients, from the beginning, have heard me say when they've come in the office, and I'll tell them, I said, in my opinion, the initial ways that they were fighting COVID-19 were wrong. They're killing people. Again, this is Dr. Tom Roselle, taking a walk down through what I know as normal physiology. So let's talk about it just for a second, because it has to do with inflammation, and inflammation has to do with what we're talking about with cardiovascular disease today. So you have this inflammatory reaction, which is really a protection. You got this virus that gets in there and the body says, oh my God, and it has to deal with it in a certain way. And then so subsequently, which comes next is this mucus, and it plugs up these little air sacs. So you end up in the hospital and you're on these respirators, and they're forcing air into the tissue because the thought is the body is succumbing because it can't get enough oxygen, which is true. But when you're forcing oxygen into a blockage, what you're doing is you're forcing the blockage deeper into the tissue, subsequently causing a more egregious problem, if you will, than what you already got. And so if the body needs something like that, there's a lot of anecdotal information right now that's coming out of the wellness communities across the world that are suggesting things that will decrease inflammatory pathway reactions, but also pushing oxygen into the tissue using ozone therapies and the like, increasing the NAC we talked about earlier, increasing the quercetin levels, making sure that you get high levels of vitamin D. And I don't want you to go running out and do this stuff, without guidance. Okay. But taking some vitamin D on a daily basis, making sure your vitamin C is up, getting a good probiotic, taking some zinc. Those things will support your immunological function, and just doing things that are very cautious. At some point, in my opinion, best thing that could happen is that, we finally see that about 70% of the United States has been infected by this crazy bug. Why? Because now you've got an antibody response. You can protect yourself. The viral antigen, if you will, you need to have an antibody that will fight it. And so we're going to go out, and the Roselle Center is going to have the test available within a very short period of time. We're negotiating at a lower cost for all of you. So when that happens, we'll let you know. And so you can get tested. And, if we can help you in any way whatsoever, we're going to make sure that we, show you how you balance that energetic and biochemical system naturally. And so your body can fight this and everything else that's out there on a day-to-day basis. So we're talking about this craziness as it relates to a lot of things, but more important, the emotional impact that it has on your heart and your cardiovascular system is profound. And there's a lot of people right now that are dying of heart attacks, which is the number one killer in the United States because of the stress pattern. Let's go back to the phones. Bill, thank you for calling. How can I help you, sir?
Hello, Dr. Roselle. Good morning. I have a question regarding reducing LDL cholesterol. I've been trying to do it by diet and exercise versus statins. And one of the things I've been doing is eating, in general, for general heart health, is eating more fish for the benefits of the omega-3 fatty acids. However, I've read that there are some studies that show that the omega-3 fatty acids actually could increase the amount of LDL cholesterol. And I'm just trying to get a handle. Is it still beneficial to eat to get the omega-3 fatty acids, or is there a risk that they might be actually increasing the LDL?
Well, let me put it to you this way, okay? So if that was the case, I would have been dead a long time ago. And because my diet is mostly fish, and I do a lot of vegan. I have some lamb periodically. I'll have a free-range piece of meat. Back in the day, before we started altering our food supply, anything that you caught wild, which was a free-range organic piece of beef or venison or whatever, had high levels of omega fatty acids. Fish have high levels of omega fatty acids. Where you have to really look out in fish is it farm raised or not? If it's farm raised, there's a problem with it. And you have much higher levels of omega-6, which are damaging to the body. You want to make sure that the omega-3 levels are adequate. So there are a lot of important considerations when it comes to the type of, and they're called apolipoproteins. So your LDL levels are broken down to apolipoproteins A, apolipoproteins B, then you have A1s and so forth. And that tells you how damaging they are and how significant they can be to your body. So what I would tell you is you want to eat only wild caught, and little fish if you can, like, the sardines and the smelt and things of that nature. They're the highest, and they come from way up north, but you don't want anything farm raised. You want wild caught Norwegian salmon. Has really excellent support mechanisms to the body. So, and things like niacin, it works within the liver to emulsify and break down fats. We'll put patients on, 500 milligrams of time-release niacin, and we see significant shifts and so forth. But the apolipoprotein A's, the really bad guys, are dangerous. Those are the ones that have higher risk levels, and you have to be careful the types of foods that you're eating and stay away from the sugars, stay away from the carbohydrates, get a little exercise, and you'll find that will modify, everything that the dangerous pieces of what we're talking about. But apolipoproteins are the breakdown. Those are the subfractions of that LDL, but you can shift that, you can change it. We're coming up to a break, and I love these questions because there's so much misinformation out there. But what he's talking about are the omega-6s that get way too high, not the omega-3s, which we want to get, and the right product is the most important. So don't go away. You're listening to Dr. Tom Roselle Live. I'll be right back.
Washington's Mall, 105.9 FM, WMAL.
Welcome back, everybody. You're listening to Dr. Tom Roselle Live, as you do every Sunday at 11 o'clock in the Eastern Seaboard. Tell your friends about us and make sure that you check us out on Facebook and all the social medias. You can go into my personal Facebook if you want to, Dr. Tom Roselle. You'll find just Tom Roselle and go down, and the only thing I publish there is all kinds of interesting health facts and things that are happening. Our last caller asked me a little bit about dropping the LDL levels, and what I want to make sure is that as I was going through, I just realized that I may have kind of misdirected a little bit. But the apolipoprotein A1 is a protein that's attached to the surface, of high density lipoproteins, and it's protective, and it enables the arterial walls, if you will, to transport stuff back and forth from the liver, which is where fats are produced to begin with. And, low levels of HDL, by the way, increase the risk of heart disease, but you have to know which one is which. So, apolipoprotein B is problematic. we want to make sure that, we understand that. So even if you get into the subfractions, the apolipoproteins A and B, then there's subfractions of that. We talked about initially in the beginning of the program, high sensitivity or coronary C-reactive protein. And that's a measure of inflammation. And then we related it to the inflammatory cascade that's going on right now with COVID-19. Again, not the same thing. It's not the same pathway, but the effect is similar. So, we're dealing with two different types of inflammatory irritations, but we have to make sure that we understand that they both do damage. And we want to make sure that we can drop the damage, or prevent it from happening. And there's lots of things that you can do to help yourself. So, as you walk through the process, the A1C hemoglobin, which is another measure of inflammatory response, it's a measure of 2 to 3 months of blood sugar levels, not just your spot glucose level. And, it's weighted heavily for, what's really happened over the last few weeks. So excess glucose that's not taken into the tissue, by the way, remains in the bloodstream. And it's a process that's called glycation. And that causes damage to the arterial bed. So this glycation, that's a result of too much sugar or a constant irritation causing inflammation, is problematic. And you need to be able to distinguish between them and understand what's really, really going on. Because if you don't get it, you're going to get it. You're going to have a problem. So understand that immunological health, wellness health, supportive health is about what it is that you do relative to your stress levels, your food intake, your exercise level. And, they all have pieces of the puzzle. You can't hope to eat like a pig or a cow that is taken to slaughter, if you will, with all the heavy grains and the stuff that they pack on, and expect to have a great immunological system that's going to protect you from a lot of things. No, nor, if you eat the right things and you're stressed out like crazy and you said, oh my God, type of thing, can you hope to be totally clear of a lot of the stuff that's out there? So make sure, please understand that your health, cardiovascular, the number one killer in the United States, COVID-19, the high inflammatory reaction that's causing, problem, no different in its consideration than any other flu. It's just the target is different. The way it affects the body, the tissues are different. But other than that, my prediction is that when we see the end numbers as time goes on, you're going to see that right now in the good old US of A, that more and more people have already been affected. And, that's a good thing because you're going to see the other numbers, the percentage. I had a staff meeting the other day and I said, here's the overall problem that you have relative to understanding statistics. And, my wife and I, Sue and I, have talked about how you can manipulate statistics to show what you want to show. But here's a situation where if you take the death rate, let's say it's 85,000 people, and you divide that by 335 million people, which is the population of the United States, your potential of dying is 0.0002 about 8. And so that shifts based on your health. Are you taking medications? Is your immune system been kicked in the pants? So somebody who's on a biologic, something like Humira or, Taltz and so forth, that decreases your body to fight anything, you're going to be at greater risk. If you have a leukemic pattern, you're going to be at greater risk. But back in the day when we had other problems throughout the history of mankind, going back hundreds of years, when people got sick, we isolated the sick and the weak. We didn't isolate the population. Again, this is Dr. Tom Roselle talking. This is my opinion based on what we see out there. Protect yourself. Support your immune system. Your cardiovascular risks begin to decrease. Eat the way you're supposed to eat, not the junk that's put out there. The sugars and sodas, the coffee, the black teas, the fast food, the fried foods, the alcohol, gluten, additives, preservatives, GMO products, the drill. Things that are really not food items that we put into our body on a day-to-day basis. We're coming up to that portion of the show where, I have to say I'll, see you next week. But take care of yourself. Don't panic. Reach out to the Roselle Center for Healing. Let us know how we can help you. We're there for you. Doctors are in position. I love you all. See you next week.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.